Hello, my name is Juan Duarte, and in this video I'm going to go ahead and talk about, not demonstrate, but talk about how to check a patient's vitals. Before you do that, it's very important that you go ahead and wash your hands, you put some gloves on, and you also put a mask on due to the coronavirus. Once those things have been done, you will go ahead and get your 4 medical instruments needed to check a patient's vitals. The 4 medical instruments that will be needed are a thermometer, a stopwatch, a blood pressure cuff that will fit your patient's arm, and also a stethoscope. Once those 4 medical instruments have been gathered, you will go ahead and verify your patient. Once you see your patient, you'll go ahead and say their first and last name to make sure it's them. And if it is them, you will go ahead and have them verify to you their date of birth. Once the patient has been verified, you will go ahead and introduce yourself like this. Hello, my name is Juan Duarte. I will go ahead and be your medical assistant, and I will be checking your vitals. But before I do that, I'm going to go ahead and check your height and weight. And then you will go ahead and tell them to follow you. And once you get to the office, you will go ahead and check your height. So you will have to go ahead and take your shoes off. Have them step on the scale, look forward, and adjust the scale. So you can go ahead and check your height. Once that height number has been found, you will go ahead and check and write that down on the patient's file. Afterwards, step off, step on the scale to check your weight, and once that number has been determined, you will go ahead and write that down on the patient's file. Once those 2 things have been completed thoroughly, you will go ahead and proceed to checking the patient's files. So first and foremost, you can go ahead and start off with checking the patient's temperature. So you get your thermometer. Every thermometer is different. It could be done under the armpit, axillary, under the tongue, oral, or side of the head, temporal. So in most cases, I'm going to go ahead and pretend that my thermometer will read the patient's temperature by placing it on the side of the patient's head. So we'll go ahead and click it. It'll be beeping, and once it's done beeping, it will go ahead and show you their temperature on the little screen. And once you see the temperature, it has stopped beeping, and you see the temperature, you will go ahead and write that down on the patient's file. Afterwards, you will go ahead and get your stopwatch and rate the patient's pulse. You will go ahead and time the stopwatch 30 seconds. Find the patient's pulse on the left radial on their wrist, your finger. Find it, and once you find it, you'll go ahead and read the patient's pulse for 30 seconds. And once those 30 seconds are up, you will go ahead and write the number down of the amount of pulses that you counted for 30 seconds, and write that down in the patient's file. Afterwards, lastly, you will go ahead and check the patient's blood pressure. So first and foremost, you will go ahead and get your blood pressure cuff, place that on the upper arm, the bicep of the patient's arm. Place it, tighten it, and make sure it's not too tight. If it is too tight, you will go ahead and tell the patient, obviously. If it's too tight, and if it is, take it off and readjust it to make sure that it's not too tight. Once it's fit perfectly, you will go ahead and get your stethoscope, put it in your ears, get the scope, place it right here, right above your forearm, or above here. And then you will squeeze up the cuff to the 140 mark, and you will go ahead and try to hear the systolic pressure. So the first lub. And once you hear the first lub, you will go ahead and decrease the pressure. While you're decreasing it, you hear the first lub. You'll keep decreasing it until you hear the last dub. So lub dub, lub dub. So until you hear the last dub or last pulse, you will go ahead and calculate that. Systolic is the first beat, lub, or beat that you hear, and diastolic is the last dub or beat that you hear. So You check a patient's blood pressure. You hear the first lub on the 110. Perfect. And you hear the last pressure on the diastolic, and it read 64. 110 over 64. You put that down in the patient's file, and once that has been done, you will go ahead and tell the patient, okay, this concludes our vital check. The physician will come in and talk to you about the reason you're here. Afterwards, that's it. That's all you do, and this concludes the video. Thank you.